I wanted to cover the concept of chronic disease, and I also wanted to do a presentation that would kind of go through the various organ systems and look at some of the common acute processes in addition to the chronic diseases that affect them. I did it from the perspective of an ER doctor. I tried to explain things to you so you would understand these acute and chronic conditions in the same way that I would explain them to a patient I was seeing as an emergency room physician, where hopefully the patient would understand the process a little better and have a little more insight into just what was going on. I've given up acute care medicine because I want to focus on health and wellness and a proactive approach to medicine that hopefully mitigates the need for the typical profit-driven pharmaceutical model of disease medicine, where we try to put a bunch of molecules in your body that don't exist naturally. They're created by man, placed in your body because of expected or proven changes in risk factors or maybe even outcome, but they generally fail compared to lifestyle intervention if you can get people to adopt those aspects, which is going to be the bulk of what we talk about from here forward. But in the beginning, I wanted you to understand the enemy. Anytime you go into battle, you need to understand your opponent if you want to have a good chance to win. Hopefully we've accomplished that. Let's review what we did. The very first discussion on chronic disease, I planted the seed that, you need to understand the basis of chronic disease in order to develop a strategy to avoid it. And because most of us are going to die of an event similar to a heart attack or a stroke, where a large blood vessel involving an important organ system is blocked and causes cell death in that organ system, and sometimes to such a degree that it's not compatible with life. So we spent a lot of time defining heart attack and stroke. And then we moved to other diseases of the cardiovascular system, high blood pressure, arrhythmias, congestive heart failure, and then we discussed the diagnosis of blood clots, or what we term in medical terminology thromboembolic disease. From there, we talked about cancer. Didn't spend a whole lot of time in cancer because it's a very complex issue. There's cancers of every organ system, but there are some breakaway tenets that we can take that, and certainly lifestyle can have an effect in that domain. Then we moved on to the diagnosis of diabetes and defined type 1 versus type 2 diabetes. And hopefully you understand that the type 2 diabetes, though genetic predispositions exist, it's essentially a lifestyle disease. Moving from diabetes to another chronic issue that we're all fearful of, and most of us have had some experience with it in some fashion or another with friends, family, is dementia. Spent a little time talking about the pathophysiology of that disorder. And then eventually I felt obligated to tackle one of the toughest things to talk about to patients, to people. One of the things I spend the most time with my patients on, and one of the most common problems that my patients have, which is being overweight or obese. And hopefully I did a good job of helping you to understand how that does tie into some of these chronic disease processes that we're trying to avoid. We had to talk about autoimmune diseases. This is where the body attacks itself. Asthma and COPD, the two main lung diseases. I think I covered a few of the other more obscure ones as well. We talked about the gastrointestinal system, liver, gallbladder, pancreas, and then we spent some time on the urinary tract. Talked about the various acute and chronic diagnoses that can occur in that organ system. And then I think I shared with you some information about becoming frail, which is another word for old age. So that's pretty much encapsulates what the outline of chronic diseases that you now have access to in my library. And if you need to go to a specific area of interest, you can just watch that video to learn about a heart attack or, maybe asthma or autoimmune diseases or whatnot. And certainly just kind of digesting it all so you have a 30,000-foot view is going to help with our approach in combating chronic disease. So where do we go from here? Well, it's back to the blood vessel, okay? We're going to look at this diagram, and I want you to pay particular attention to the factors that cause the progression of blood vessel disease. Now, we can look at this diagram and think about any artery in the body, whether it's a tiny little artery, like, what we would call an arteriole, just about to feed a specific organ, or a large artery that's carrying blood from the heart to the branching system that's going to feed any of the individual organs. This process is occurring throughout our blood vessel system, from the big giant base of the tree, the root system coming out of the aorta, all the way down to the tiniest arterioles feeding our retina. The process that you're looking at in this diagram is occurring. And along the top of the diagram is the kind of stages of what's happening as we develop atherosclerosis, or hardening of the arteries, or plaques, which I use that term frequently. And at the bottom of the diagram are host factors that accelerate the steps in these processes. Let's just talk about this a little bit. The first thing you see is what we call injury activation. You notice there's a little separation in the junction of the two walls lining the endothelium, the two cells that are there. You see that little junction is spread out a little bit, and there's kind of some redness to indicate like inflammation. And when we look down at what causes that, we see energy intake, increased saturated and trans fat, smoking, and decreased physical activity. Inflammation. This is one of the three big things that drives chronic blood vessel disease. And we will notice, if we look at the bottom of the diagram, we see increased energy intake at the top of all of those. Well, increased energy intake. Food is inflammatory, so if you eat too much of it, you're increasing your basic inflammation. The obese state is inflammatory, so increasing energy intake is likely to increase energy stored, and that fat tissue causes a chronic inflamed condition. And you notice that increased energy intake is implicated in all of the steps in this process. And part of that is probably due to its cause of obesity and obesity's effect on the inflammatory state. But another driving factor that's effective at this stage is glycation, increased sugar. We talked about this in diabetes. Diabetics get everything that regular people get, they just get it faster. And the root problem in diabetes is that the amount of sugar in the bloodstream is increased. It looks like this sugar probably glycates or attaches to everything, and it causes inflammation, and it causes acceleration of these processes as we move from left to right down this blood vessel, from a non-injured blood vessel wall to one that is starting to incorporate these LDL particles, which is the low-density lipoproteins, ultimately that are oxidized and become enveloped by a type of cell called a macrophage, which then penetrates the wall of the blood vessel and forms this yellowish looking stuff that we're starting to see called a plaque. And as we look at some of the other things that affect this process, we see again saturated and trans fat, and that is probably to some degree implicated in how high your LDL cholesterol, how many of these little particles that are going to get through this swollen opening in the vessel wall initially created by injury and inflammation, how many particles are there to penetrate? Because it's, at the end of the day, it's numbers that probably have some effect on how fast this process occurs. Though certainly your LDL is not your major risk factor, but it's involved in this equation. And consuming a diet that results in higher LDL cholesterol, which is the typical American high-fat, saturated fat diet, will accelerate this process. You notice that smoking is present in every single component. Smoking is the most inflammatory thing you can do. I mean, it causes systemic inflammation. When you smoke a cigarette, you are inflaming an organ system that if we laid it out flat, the surface area would cover a tennis court. It's called your lungs. When you inflame an organ system that large, repeatedly, day after day after day, that inflammation is being transmitted throughout your entire system, and your blood vessels are becoming more inflamed. And we know beyond a shadow of a doubt that smoking accelerates this process of narrowing that channel that's going to deliver blood to your vital organs for the rest of your life. It accelerates that process considerably. We also know that inactivity, which is present in most of these steps, is a risk factor for acceleration of this process. Exercise is the best pill that we have. And sedentary lifestyle is an inflammatory state as well, and it drives all of these processes. So what we see, as I mentioned in this diagram, is this endothelial injury precipitated by inflammation, loss of the connectivity of the cells to one another lining the vessel wall, allowing these LDL particles to penetrate, eventually consumed by macrophages, and developing into this plaque that is behind the vessel wall, between the muscular layer of the blood vessel wall and the single cell lining the endothelium, further narrowing the lumen or the channel that delivers blood to whatever's on the other end of this blood vessel. Now, the end thing, the thrombosis that you see there, generally triggered by a rupture of the vessel wall, allowing extrusion of one of these plaques into the blood vessel system, causes an immune reaction with platelet clumping and the formation of a clot. And what that does is it takes a previously narrowed blood vessel that may have been providing adequate oxygen and nutrients to the tissue and completely blocks it off, and everything at the other end dies. I know we've talked about this before, but that sort of covers it. So there are three factors that are the main drivers of blood vessel disease. All of them can be intervened in the lifestyle equation. There is inflammation caused by diet, obesity, lack of exercise, and a poor omega-6 to omega-3 ratio, which is related to diet, but can also be targeted with supplements, which we will talk about at great length when we finally get to supplements, which is a long ways off. But I'm talking about either a diet high in fish or well-sourced, molecularly distilled, highly concentrated marine fish oil, hopefully from a sustainable source. Number two, we're talking about LDL particles penetrating that inflamed vessel wall and accumulating behind the lining and causing narrowing of the lumen. And we're talking about glycation, which is high sugar, accelerating the process. Let's just look at it like we're wrapping everything with sugar, makes it sticky, and just things go bad. So those are the three main driving forces of the development of arterial blood vessel disease, atherosclerosis. And what we're going to do next is we're going to talk about, number one, how do we monitor these conditions, these factors? What are the ways that we can receive biofeedback about how we're doing in these categories? And then eventually we're going to talk about how to improve them. And obviously that's going to be nutrition, exercise, supplementation, and we'll talk about the concept of hormone optimization in this whole paradigm. We're a ways away from that yet. Thanks for sticking with me.